Good evening, cohorts. I am quite delighted and honored to be able to discuss with you a condition that is dear to my heart. A good friend of mine has a condition called hemophilia. It's something I've always wanted to learn more about, but never taken the opportunity to do so. So now we have that opportunity, and I'm pretty excited. I apologize in advance as the video is dark. I could not get the recorder within Schoology to work. So this is what we have, plan B. Moving on, hemophilia by definition is a bunch of genetic disorders that share the characteristic of missing the plasma protein that helps our blood to clot. My friend Tammy, very simply, she's just always said, I'm missing the factor that helps my blood to clot. She was always a super high risk pregnancy. So, for example, she would have to go to Omaha about once a month to be checked. If she was within 2 to 3 weeks of her due date, they always highly, highly recommended that she not be within more than an hour of Omaha because no one out here would deliver her. And that has to do with the shot that the doctor would give her in order to help her blood to clot. That would actually, I think it just puts that factor into your blood if you're a hemophiliac that helps you clot. Hemophilia is carried on the X chromosome. So men pass it on to their daughters, and women pass it on to only about half of their sons. So Tammy always had to find out the gender of her baby before the delivery, just so they could check the baby, make sure they knew what was going to be happening with him or her. And as I said, it's only passed to about half of a woman's sons. So of Tammy's 2 boys, one of them for sure has it, and I'm not sure about the other. Hemophilia is most common in men. According to our textbook, about 20,000 people in the U.S. do have hemophilia. If you narrow that down, 1 in 10,000 people approximately has hemophilia A, and 1 in 50,000 people have hemophilia B. Now, you might be wondering how hemophilia works. Well, let me tell you. What happens is that the thrombocytes, which is the part of the blood that helps it to clot and keeps us from bleeding to death, it's constantly maneuvering throughout our circulatory system checking for problems. If your thrombocytes find a rough spot, then they stick themselves to it, and then they release a bunch of chemicals that cause a whole bunch of other reactions within our blood plasma. There are clotting factors then from the liver that partner up with the thrombocyte secretion, and they weave these little nets of protein fibers, also known as fibrin. And you thought you weren't crafty. Okay, that was a bad joke. These little nets then catch the passing red blood cells, which is what causes a plug, and then that limits the amount of blood that tries to escape through the damaged blood vessel. The little weaver guys then spend their time weaving the fibrin nets. The little weaver guys that spend their time weaving the fibrin nets have been narrowed down to 12 individual factors. When hemophilia is present, it is because there is actually a genetic mutation that caused there to be a deficiency in one or more, in some cases, of those 12 factors. Without all of those factors, a person has trouble forming a good solid blood clot. Keep in mind, hemophiliacs don't bleed faster, they just bleed longer. Hemophiliacs have to be very careful. Tammy was always a serious athlete. She played ball in college, all through high school. She played softball, basketball. Basketball was her game. She loved basketball. But at a young age, she had to learn how to fall and to fall properly. If you think about it, a person who doesn't clot properly, if they hit their head just right, or even if like somebody were to nail them in the chest really hard, hit an organ, they can bleed to death very simply. I'll never forget watching her play basketball when she was 8 months pregnant. She tripped and she did this amazing tuck and roll thing, and the entire gym went she stood up. She goes, guys, I learned to fall a long time ago. I got this. It was terrifying. Another example is her son Titus, the one who has hemophilia. He was about 5 or so when he fell off of their swing set and landed on his face. When I saw him, it looked like somebody had just socked him, just in each eye, and all the way around here was just black. It was so sad. I'll never forget, I asked him, I said, Titus, are you okay? Does that hurt? He said, no. Sure looks bad, though, doesn't it? Poor guy. According to our textbooks, bleeding into muscles can cause pain and numbness because it causes the nerve endings actually to compress. If the pressure is then not quickly resolved, the muscle may develop a compartment syndrome or a contracture, which then would lead to a permanent loss of range of motion. The muscles that are the most at risk of hematomas are the thigh, the calf, the upper arm, and the forearm. What I did not know is that there are actually 3 different types of hemophilia. Very creatively named. Are you ready for this? They are hemophilia A, hemophilia B, and von Willebrand disease. Type A is the most common. It accounts for about 80% of all cases of hemophilia. The major characterization of type A is a deficiency of clotting factor 8. In rare cases, a person actually develops antibodies to that factor, and that's called acquired hemophilia, also very creative. The type B is also known as Christmas disease. So, of course, my very first question was, why is it called Christmas disease? It's characterized by insufficient levels of factor 9. And the reason that it is called Christmas disease is because there was a 10-year-old boy who they couldn't figure out why it seemed like he had hemophilia, but it didn't follow the norm for hemophilia. And they discovered that there was then a different type of hemophilia, and that 10-year-old boy's name was Stephen Christmas. I was thinking Christopher Christmas, and that's not right. It was Stephen Christmas. Von Willebrand disease happens when a person has a lack of factor from the liver. It's a dysfunction of the von Willebrand factor, which I didn't even know I had. Did you? The von Willebrand factor is a substance that helps platelets clump together, and then it allows the factor 8 to do its job. Unlike type A, von Willebrand can happen in men or women. It can happen in men or women equally because it has no basis at all in the X chromosome. It's from the liver. If a person has severe hemophilia, rigorous massage is strictly contraindicated. You can do light touch, you can do gentle massage on a person with severe hemophilia. If they have milder hemophilia, it can be, they can take more rigorous massage as long as it's within their pain tolerance and doesn't cause any type of bruising. Persons with mild or severe hemophilia massage can be very beneficial as long as it, like I said, as long as it doesn't cause bruising or tissue damage or anything that would cause them to bleed or any unwarranted bruising or anything like that. I've actually massaged Tammy twice. I don't know if you remember me talking about the bladder point on the feet. I know Cecilia will. That was her. And so she ran the market to market relay. She did 3 legs of it. I don't even think I could do 1 leg. Anyway, that is all that I know about hemophilia thus far. I appreciate the opportunity to be able to learn about it and then to share with you something that really just intrigues me a lot. Have a fabulous evening, and I will see you in the classroom.